we are talking about true ocular emergencies that need treatment within hours or loss of sight is possibly inevitable. From early on, we're taught how to identify someone who's in a life-threatening situation. A lot of us are required to know CPR for our jobs, and many of us from a young age know the symptoms of a stroke. These are very important lessons that could save a life. In emergency situations, there's a certain triage that's followed with the immediate goals to save life, limb, and sight. This gives medical personnel a guide when they're faced with difficult decisions. Let's say, for example, if there are a lot of injured people, but not very many staff available to help treat. Seeing that the importance of saving a life is followed very closely by saving sight, we should know the symptoms as a general population of how to address someone with possible sight-threatening injuries or diseases. So I believe the general public should be aware of things to look out for when vision could be threatened as well. We're going to talk about 4 ocular emergencies that you need to know. Now, of course, if I don't mention something in this video, that does not mean you should not seek immediate care or that it's not an emergency. There are lots of eye emergencies and urgencies that should be treated promptly. But for this video, we are talking about true ocular emergencies that need treatment within hours or loss of sight is possibly inevitable. Categorizing various illnesses and injuries as ocular emergencies and urgencies simply helps clinicians to have a guide that they can follow so that they know what to do in emergency situations or when time is running short and quick decisions need to be made. But as a bottom line, if you have an injury or something changes in your eyesight, you really should seek care right away. Our first true ocular emergency is a Central Retinal Artery Occlusion, or a CRAO. Today I'm going to focus on the symptoms because that's what you need to be looking out for. I'll discuss in a later video more about the treatments and the causes because that's important to know in order to manage your health because, as we always say, preventative medicine is the best medicine. CRAO for the most part is caused by underlying systemic diseases, things like high cholesterol and cardiovascular disease. This can cause a little embolus to break off and block the blood flow through an artery, a very important artery in your eye, and blockage to this blood flow means loss of sight. Symptoms of a CRAO would be unilateral painless acute vision loss, which means vision loss on one side that happens suddenly. There's no pain involved and the vision is very poor, usually around counting fingers or light perception. In someone with a CRAO, it's possible that they've experienced something in the past called amaurosis fugax, which is basically a short-term blackout of their vision in one eye. And this is because the blood flow is temporarily blocked in that eye, but fortunately it passes and the vision returns usually within 90 seconds or so. So if you've had amaurosis fugax, it's very important that you're evaluated by your eye care provider quickly, and they can make the proper referrals as well to doctors to check out your overall systemic health to make sure that a CRAO does not happen to you in the future. It's so important to seek treatment for this within 90 minutes because the longer any part of your body is without blood, the more likely it is that that area or that tissue will die. And the longer this goes without treatment, the worse the prognosis is. So people that go for too long without seeking care tend to end up with vision at the level of just light perception, only being able to tell whether the lights are on or off in that eye. And if this has happened in one eye, there's quite a high risk it's going to happen in the other eye because it's not an eye problem, it's a systemic problem. So it could happen again, but affect you in another area. The next true ocular emergency that needs immediate care is a chemical burn. You will know if this happens to you, obviously, and you will likely be experiencing symptoms of pain, redness, irritation, tearing, an inability to open the eye, and the sensation that something is in your eye. If you do have a chemical burn, that area needs to be flushed with water for 30 minutes minimum. You don't need to stop to remove any contact lenses. It's important that that area is flushed immediately, that chemical is diluted and removed as fast as possible. If you don't have water nearby, you need to go to the nearest emergency room or eye doctor immediately. And if you do have water and we're able to irrigate, that's also your next step. Go to seek care from an emergency room or an eye care provider immediately. There are some special situations because there are certain chemicals that when mixed with water, it creates the chemical reaction that could make the situation much worse. And in some cases, particles may need to be removed from the eye with forceps before irrigation is done. Now, this is why it's so important to know what chemicals you're working with ahead of time. Read the label in case of an accident, but of course, preventative medicine is the best medicine, so wear your protective eyewear. It's not only important for you to know what chemical you're working with, but also whatever provider ends up treating you. So it's important to bring the bottle with you so they can see what chemical they're dealing with to best know which direction to take in your treatment. If you're in a workplace situation, you're probably familiar with the term medical safety data sheet, and you should bring this with you to the doctor as well. If you work with chemicals at your job and you don't feel comfortable or confident with what to do in an emergency situation, be sure to talk to a supervisor or an employer. And if they're not being helpful or you still feel like questions are unanswered and you feel uncomfortable, then call OSHA, they can help. The third true ocular emergency would be a perforated globe. This would be a very severe injury to the eye that means it is pierced all the way through in one location or another. This isn't just like a corneal abrasion where it would be a small scratch on the front of the cornea. This would be like a hole goes all the way through the cornea, and there is now opportunity for the outside world to interact with the inside of your eye. This could also occur in the sclera, the white part of the eye. There could be a perforating hole all the way through to the vitreous. Any exposure of the eye to the outside world is incredibly dangerous. If you have an eye injury of any kind, you don't have to be the one to decide how it's going to be treated. You should go to your eye doctor anyway, and they'll be the one to evaluate the severity of the condition and how to manage it based on that. The final true ocular emergency we're going to be talking about today is acute angle closure glaucoma. I've talked about glaucoma in a lot of my videos so far, and that's because it's a really important condition to know about, especially acute angle closure glaucoma. Acute angle closure glaucoma could happen to somebody who's totally not expecting it. It happens to people with certain eye anatomies where the angle between the back of the cornea, the front clear part of the eye, and the front of the iris is narrow. This particular angle is where fluid exits through. We constantly have fluid flowing through our eye, and that is what allows it to function and live. But if this fluid builds up too much and can't escape through this little angle, the fluid builds up so rapidly that we get glaucoma, but it's like that. That's why it's called acute. A normal eye pressure really varies, but it usually lays somewhere between 11 and 21. And when there's a huge spike in eye pressure, your eye doesn't bulge forward like I think some people imagine in their heads, but instead this pressure pushes backward toward the optic nerve, which connects the eye to the brain. Symptoms of acute angle closure glaucoma would likely just be in one eye at a time, and they would be pain, blurred vision, seeing colored halos around lights, nausea, a frontal headache, or a major eye ache. It may be difficult to spot at times because not everyone who has acute angle closure glaucoma experiences these symptoms, especially to that great of a degree. So if there's anything unusual, or if you're seeing halos and you have blurred vision and maybe even just a little bit of pain, but not necessarily the severe pain and nausea, you should still consider that this may be what's happening. I have known people who have had much milder symptoms when they still have acute angle closure. Another thing to think about is if you had mild versions of these symptoms in the past. Some examples would be like going from a dark experience to a light place, like leaving a dark movie theater and going outside in the daytime and experiencing maybe some mild halos around lights, and things just don't look quite right for a moment, but they return back to normal. This can happen in people who are getting close to having an acute angle closure glaucoma attack, but they don't quite get all of the way there. So if you've had some strange experiences that seem like this before, you really should see your doctor because they can do a procedure that will prevent this from happening. The reason this is so important to treat immediately is that the prognosis declines over time. If this isn't treated within a few hours, the affected eye can become fully blind. But if it's spotted and treated quickly, you can often save the vision, and sometimes even the peripheral vision will be okay, as long as you seek treatment fast. I wish I had some cool acronym to remember all of these important ocular symptoms to look out for, like they have FAST for stroke, but we'll just talk about what makes sense, I suppose. Obviously, in the case of a chemical burn or trauma, like with a perforated globe, those things are pretty clear. If you have trauma or if you've been exposed to chemicals, seek treatment right away. That's a no-brainer. When it comes to other ocular emergencies, you just really have to think, if something is happening suddenly out of the blue, it's probably a problem. If your vision has gotten blurry slowly over the past year, yeah, maybe you need new glasses, or maybe you're developing cataracts. But it's very different to experience sudden changes in vision. So remember, anything that is sudden, a large change in vision, especially going from excellent vision to no vision at all, even if it's just for a few seconds, nausea, vomiting, headaches, any pain around the eye, that should be a red flag to you. But remember, not all of these ocular emergencies present with pain. Remember the Central Retinal Artery Occlusion we talked about before? That's painless loss of vision. So if you're not in pain, that doesn't mean you're scot-free. Hopefully you feel a little bit more prepared in case one of these ocular emergencies happens to you or someone that you know. Remember, it's so important to stay educated and to act quickly. Preventative medicine is the best medicine, so maintaining excellent systemic health will also help to protect your eyes. There are many other ocular emergencies that need prompt treatment. The ones I covered today are just the ones that in particular need to be treated within 2 hours or sometimes less. So if something seems wrong, call your doctor. Thank you for joining me today. I plan to break down these diagnoses in a little further detail in future videos, so be sure to subscribe if you want to hear more, and we have plenty of other things to cover. So I hope to see you next time. Thanks for joining.